My name is Imelda Galvin, and I'm an assistant professor of critical care medicine and anesthesiology at Queen's University and Kingston Health Sciences Centre. This project is looking at compassion from the perspective of families of critically ill patients who are dying in the ICU. The project the research project coincides with the introduction, implementation, and evolution of the Three Wishes program. The Three Wishes program is an initiative that was first developed in Hamilton by a group of intensive care physicians, palliative care physicians, and spiritual healthcare professionals. It aims to personalize the end-of-life experience for critically ill patients by eliciting and fulfilling a minimum of 3 simple wishes. These wishes can be expressed by families or they can be expressed by the patients, and commonly expressed wishes are for personalizing of the environment with blankets, Zoom videos with family members who cannot be present in person, music, spiritual ceremonies, and often mementos for the family, which include things like fingerprint keychains and locks of hair and sympathy cards. We are, with the help of the foundation, we are implementing or have implemented this program. It is starting up the Kid to ICU, and coinciding with the program, we are going to measure what families perceive healthcare professional compassion to be during the introduction, evolution, and expansion of the program. Compassion is a key quality indicator, or consistently ranked as an important aspect of care by patients and their families, as well as by healthcare organizations and governing bodies. And core among the goal of the Three Wishes program is the promotion of humanistic and compassionate care. So that is what our project is, and we are going to use the Sinclair Compassion Questionnaire to get a quantifiable measure of compassion. Because a lot of the research around the Three Wishes program has been qualitative, and while massively informative, it has not yet provided us with a complete picture of how this initiative affects compassion, both from a healthcare professional point of view and from a family perspective. I think we'll have a number of important impacts on healthcare delivery. First of all, it will allow a consistent and tangible avenue by which compassionate care can be delivered to dying patients and to their families. It will also increase healthcare professionals' awareness of compassion and create a culture of humanization and compassionate care, bringing it to the forefront of care of critically ill patients. It will also give us an opportunity to engage families actively in healthcare and to engage them as partners in care, often at a time when families feel suffering most acutely and grief is at the forefront of their experience. And it will also provide us with the first quantifiable measures of compassion and allow us to determine which domains of compassion are most influenced by this program. It's already been, the Three Wishes program has already been adopted with viral enthusiasm on the Kid to ICU. We have several champions among our nursing staff, our allied health staff, and our physician staff. And it is a program that really our champions are the wings of Three Wishes. And it's a program which has been adopted and welcomed by patients, families, and healthcare professionals. And I think it has a huge role in maintaining healthcare professional well-being as well and reducing burnout. I am honored and privileged to have this funding. I am really thrilled, as are all of the Three Wishes team. I think it is so reflective of Kingston Health Sciences and SEAMO's commitment to patient-centered and family-centered care. I think it is SEAMO is an inspirational organization, and as is Kingston Health Sciences Centre. I think both have a vision of patient-centered care, family-centered care, and understand therapeutic relationships as being more than just a therapeutic relationship. It's a relationship of healing. And to have the support of SEAMO Innovation to allow us to do this study in concert with the funding that we received from the foundation to run the program, it brings end-of-life care to another level. It brings it beyond the level of just withdrawal of life-sustaining therapy and initiation of comfort measures. It brings it to a time of celebration of the lives of our patients, celebration of their family connections, and I think it is just really a beautiful thing that we are privileged to do, and I am absolutely honored that it was funded by SEAMO Innovation Fund. Well, first of all, I would like to thank the foundation for supporting the program. That has been something that has allowed us to get the program started and allows us to grow that program and develop it. Also wanted to thank the SEAMO Innovation reviewers and IFPOC for selecting our research program to be a recipient of this award. And I do not want to forget in this the really important contribution. I am just one person on the Three Wishes team. Three Wishes team is a massive collaboration. We have a lot of nursing staff on the ICU. We have a lot of allied healthcare professionals. And these people, as I said, are the wings of Three Wishes. Without them, we would not be able to do this. We do things like make mementos, record heartbeats of patients and give them to their families. And we run a WhatsApp group where we share ideas, and often something will pop up in the WhatsApp like, does anyone know how to do this? Or a family have asked for this, and someone will respond and often come in from home to make a wish come true.